Hello everyone. I did this presentation actually not too long ago, yesterday I want to say to be exact, and it's about coronavirus, kind of the current situation that's going on. This was generally meant for co-residents and other physicians and colleagues at the hospital, but it could be applicable to anyone else at this time. So I kind of just wanted to talk about coronavirus, what it is, kind of the current situation, some of the wellness stuff around it, the testing, etc. So let's get right into it. Okay, so coronavirus in a nutshell. So what is it? It's the SARS coronavirus 2 strain causing COVID-19. You've previously known about this. It's known as the novel coronavirus. Is how it was previously described. It's a positive sense single-stranded RNA virus. It was first detected in Wuhan, China, and then the origin we think is bats. So the first case in Wuhan was November 17, 2019. That was the first reported case. It became a public health emergency as of January 30th of 2020 and a pandemic as of March 11th of 2020. There's different theories about the reservoir and all that. So it says it's the pangolin reservoir and that it was in the Huanan seafood market, but we don't know if we brought it into the market or got it from the market. So those are some theories that we're still working on and thinking about, but I won't delve into that further. I'm sure you hear about a bunch of controversies in the politics regarding this. All right, so our next slide, we're talking about viral transmission. So basically, it's person to person spread, right? Happens to anyone with the close contacts via the respiratory droplets. So, how does this work? It's when an infected person coughs, sneezes, or talks. This can land on the person of those people that are nearby or inhaled into the lungs via the same surfaces, okay? The mouth, the nose, and the eyes. New studies show that actually there's some question about asymptomatic carriers, and this may be demonstrated in about 20% of people. They're saying it now. So we'll see how that ends up turning around. So, what are asymptomatic carriers? Those are basically the people that carry coronavirus and would actually test positive but have no symptoms. So, this is a very important way of spreading it, which is why we're so big on please stay at home. Okay. The other thing is contaminated surfaces, which we mentioned, and then also basically if the person who coughs, sneezes, or talks touches their mouth, eyes, or nose, and then puts their hand directly on a surface, and then you touch that same surface, whether it be a doorknob or etc., and then you touch your eyes, then that's another way for the virus to be transmitted. Other things to note is we try to avoid aerosolizing procedures, which is what this last slide is about. We're not sure about airborne transmission from person to person at this time, and it seems like it's unlikely, but that's why we try to avoid aerosolizing procedures, intubations. A lot of things is changing about that. Like some will say to not even use high flow nasal cannula anymore as a way to oxygenate your patients, which is why people might be intubated faster. That comes with some ethical issues on its own, but this is why the reasoning is behind it of why people don't do it. All right, moving along. So, I think there's a lot of misconception about this whole situation of who gets the virus. So, we just want to clear it up here now. Anyone could get the virus. There are just certain groups of people that are increased risk for having a serious illness from COVID 19. So, these groups of people include the elderly, age greater than 65, with or without any comorbid conditions, nursing home or long term care facility residents, younger age groups with these following comorbidities: so asthma or chronic lung disease, serious heart conditions, those who are immunocompromised. So they say for HIV patients it's actually unclear. However, immunosuppression is the key situation here. So if your HIV is poorly controlled, then that would be a reason why you would be at higher risk. Others are obviously AIDS patients, people on prolonged use of steroids, corticosteroids, and other immune weakening medications. The next thing is obesity and type 2 diabetes. This is pretty interesting, and the reasoning behind this is likely the inflammatory response that you get with obesity. They kind of on CDC and all those, they say it is for people who have a BMI of greater than 40, but new research that kind of came out a few days ago actually shows that maybe even anyone with a BMI of greater than 30. So obesity type 1 and up. The other thing to note is CKD is another thing that could put you at increased risk for serious illness, and those are mostly for people in CKD stage 5 who are on hemodialysis and people with underlying liver disease as well. So let's talk about the current situation. This could change depending on when you listen to this. So the current situation globally, as of yesterday, the confirmed cases was about 1.9 million, recovered 450,000, deaths of about 120,000. It's the current situation in the United States. Total cases of 586,000, recovered to 43,000. Total deaths around 24,000. And then I want to talk about California and Riverside County in particular because that's where I'm at. So California total cases was around 22,000, recovered 307, 651 deaths. And then Riverside County total cases of about 1,751, recovered 297, and 50 deaths. So this is an evolving situation, especially on the West Coast, because now it is starting to really come to this side, even though we've taken a lot of precautions compared to some of the other places. Again, leaving my political views aside, let's go to the symptoms. So symptoms range from mild to severe. They can appear anywhere on average between 2 to 14 days after exposure, although we have known of cases of the virus shedding well beyond that, up to like 24 days. So just be aware of that, which is why we stress please stay home. Don't know why that's so hard to do for people. But anyways, so these symptoms that are included typically is fever, cough, and shortness of breath. So most people have mild illness and recover at home without any medical care. And then the other symptoms that you should know is fatigue, sore throat. That kind of happens in less than 10% of cases, so it's more rare. Anorexia, myalgias, which are muscle aches. Anosmia, which is loss of smell. And then people have loss of taste, so certain taste disturbances. And GI symptoms, which occur in actually less than 5%, so that's also rare. Anyways, immediate medical attention for those who exhibit trouble breathing, persistent pain or pressure in the chest, new confusion or inability to arouse, and then cyanosis or the bluish lips or face should go immediately to their nearest emergency department. With or without coronavirus, these are symptoms that require immediate medical attention, so this should be kind of obvious, especially for any physicians that are listening to this. And then other things I want to mention briefly. So they did a cohort of more than 44,000 people with COVID-19 from China. This was the largest cohort. And it showed that illness severity can range from mild to critical. So the overall case fatality rate was 2.3%. The case fatality rate among patients with critical disease was 49%. And then we don't really talk about children because they're not as affected as much, but I wanted to briefly mention it. So among children in China, illness severity was lower, with 94% having asymptomatic, mild or moderate disease, which kind of makes sense as to why this asymptomatic carrier thing is really becoming to be something that is exploding, because there's many people that are asymptomatic and don't know. I actually have a kind of a sad case. I have one of my friends, their family members on some immunosuppressant drugs, and basically one of the children brought it into the house, had some mild illness, and then the parent got really sick and ended up dying. So this is another thing that's really important as to why we stress staying home, avoiding getting sick, and taking the right precautions, that if you do have family members and you do have to leave the house for some reason, you might want to quarantine yourself separately from them for reasons like this. Who else? 5% of these children had severe disease and less than 1% had critical disease. Other things to note, that among U.S. COVID-19 cases with known disposition, the proportion of persons who were hospitalized was 19%, and the proportion of people with COVID-19 admitted to the ICU was 6%. In the most severe cases, you'll see cases of pneumonia, ARDS, kidney failure, and obviously death. But the majority of people have symptoms of mild to moderate symptoms in 81% of people, severe symptoms in 14%, and people who are in critical condition is around 5%. Moving on to clinical progression, I'm sure you have seen this. A lot of physicians have posted their own things about this, so this is kind of the criteria that is across the board pretty similar. So from time of onset, shortness of breath develops between 5 to 8 days. ARDS develops between 8 to 12 days. ICU admission between 10 to 12 days, which obviously correlates with the development of ARDS. And then ICU mortality rates range from 39 to 72%. This was one study that was conducted, and obviously this range is pretty significant, but as people make more studies, we'll be able to really figure out the ICU mortality rates moving forward. And then the median length of hospitalization among those who survive from COVID-19 is between 10 and 13 days. All right, moving along to labs and imaging. This is kind of a very important slide. I think it is for everyone, patients and the general population alike, and obviously physicians. So the most common finding is lymphopenia. That is seen in 83%. Other symptoms, labs that you may see, is neutrophilia, elevated ALT, AST, and elevated LDH, CRP, and ferritin. So these are actually maybe associated with greater illness severity, so that's why those are mentioned, but they're not necessarily a diagnostic indicator. It's more so that they could be severely ill if they have any of these. A normal procal is seen from most people who, once they're admitted. And then the procal obviously may be increased in those in the ICU. There should be obvious reasons for why that happens, so I'm not going to get into that further. Next thing is the elevated D-dimer. So that's actually related to the mortality. So that's an important point that will point you towards that. So if it's elevated, you are increased risk for mortality. Critical illness is the other thing. So in critical illness, you'll see high plasma levels of inflammatory markers. There's some potential for immune dysregulation here, which is why you'll see that. So that's something that is to be noted. Next thing is the imaging, and we talk about this a lot. So we see radiologists, and this is not more so to blame them, it's just to point that out. So obviously we've been talking about bilateral airspace disease or ground glass opacities for many times, and many things cause it way beyond corona. So it's more so a legal aspect of why radiologists would likely report this and state, oh, we can't rule out COVID because during this time a lot of these patients end up showing this type of picture. But setting that aside and understanding, critically thinking that there are many reasons for why you may have this imaging beyond COVID. So we need to be very well aware of that. So on a chest x-ray, as you can see below, bilateral airspace consolidation is what you would see. And then on a chest CT, you'll see bilateral peripheral ground glass opacities. Don't know if you need me to point them out. It's pretty obvious, even if you're not a physician, to see that there's something wrong there. So note the CT imaging is not specific. Either imaging alone is not recommended for diagnosis, and it's actually not recommended as a first-line test for diagnosis. So like everyone else in medicine, or many other diseases in medicine, you got to put the full clinical picture together to actually come up with these diagnoses, okay? Moving along, let's talk about some diagnosis and testing. So technically what it is, it's we're detecting the SARS coronavirus 2 RNA by reverse transcription via PCR. Nasopharyngeal sample is better than a throat sample, so that's why I just wanted to mention that. So usually what we're doing is the nasopharyngeal swab. I'll tell you about my personal experience. This is not a fun test at all, and actually literally feels like your brain is kind of being tickled. You start crying after because it's so deep in there. But anyways, there's also lower respiratory tract specimens that people can obtain if feasible. So because this might have a better yield. So I've noticed this in intubated patients. You could take a tracheal aspirate or a BAL sample. If you have a patient with a productive cough, you do want to obtain sputum cultures. So those should be collected as well, but you should not do sputum induction, so that's not suggested. It's also been detected in stool and blood, the virus shedding. So if this is found in blood, there's some evidence that shows that it may be a marker of severe illness. Then I wanted to go over the priorities of who should be tested and not. This is per the CDC. So priority 1 is obviously any hospitalized patients and then healthcare facility workers with symptoms. Priority 2 is patients in long-term care facilities with symptoms, patients that are elderly with symptoms, patients with those underlying conditions we mentioned with symptoms, and then first responders with symptoms. Priority 3 is those that are critical infrastructure workers, so that's like grocery store clerks, people who work in FedEx and UPS, etc., and individuals who do not meet any of the above categories with any symptoms, healthcare facility workers and first responders with or without symptoms, and then individuals with mild symptoms in communities experiencing high numbers of COVID-19 hospitalizations. So those communities, let's say in New York, there's a lot of people with these symptoms in Queens, for example. So in those situations, that would be a priority 3. Obviously, non-priority are those without symptoms, so don't come in and get tested if you don't need to. That is as pointless as it can be. Moving right along, I want to talk about some current treatment guidelines. And this is probably a very, very important slide that I want to discuss. So obviously, typically, it should be supportive care, rest, hydration, supplemental oxygen. I really wanted to stress the supplemental oxygen because the goal O2 sat, we always write it in our notes and we say goal O2 sat 92%. Then we walk into the room and the patient is satting 99% and 2 liters nasal cannula. They don't need the oxygen, but yet we still do it. Our systems in general are never going to be perfect, and there's always going to be some flaws in there. But I think more so now than ever, this is very, very important because we need to monitor the oxygen saturation of these patients. So I cannot stress that enough. Please make sure if the O2 sat is greater than 92%, do not keep them on oxygen so we could actually monitor what their oxygen requirements are. Other things is, let's talk about acetaminophen. So if you could break the fever with just Tylenol alone, I would recommend using that. There has been some hypothesis that NSAIDs can worsen COVID-19 due to like the whole inflammatory theory, but there's no data to date suggesting the association between the two and clinical outcomes. But for peace of mind, you could avoid the NSAIDs in the meantime if Tylenol is enough to break the fever alone. The next thing I want to talk about is ACEs and ARBs. That was particularly interesting. So it's been hypothesized that ACEs and ARBs can increase the risk of the coronavirus infection and COVID-19 severity. So ACEs and ARBs increase the expression of ACE2, obviously, and the SARS coronavirus, there have been previous SARS and MERS infections that use the ACE2 receptor to enter into the host cell, okay? But there's no data to suggest a link between ACE inhibitors, ARBs, with worse COVID-19 outcomes. So basically the AHA, the ACC, the HFSA, they released a statement saying to continue these drugs if you're already receiving them for other things like heart failure, hypertension, or ischemic heart disease. So it's safe to say to continue them for now. I understand the logic of why there's concern about it, but we haven't developed a direct correlation at this time. Next thing, I want to talk about treatments in general. So there's no specific regimen approved by the FDA. Remdesivir is one of the medications that's actually really promising. It's an IV drug, a broad spectrum antiviral. It inhibits viral replication. It was originally designed against Ebola, and then there's one clinical trial recently approved by the FDA in the United States and 2 trials implemented in China. So that's something that's coming up soon. Next one is hydroxychloroquine and chloroquine. They're under investigation for both pre- and post-exposure prophylaxis. I'm sure we've heard people taking this, as well as for treatment. There's currently 10 clinical trials underway. It may be getting some backlash right now from the political standpoint in the media and all that. But realistically, it is a medication that has shown a lot of promise. I have seen patients use it. I've seen people do it for post-exposure prophylaxis. It's kind of hit or miss whether it works or not, but trial and error is something that's on our side right now and something we have the opportunity of doing, and we should take it if the benefits outweigh the risks, which is everything that we do in medicine, right? Because we all took a Hippocratic oath to do no harm. The next thing I want to talk about is lopinavir and ritonavir, aka Kaletra. It had a lot of promise in the beginning. This is an HIV drug, but there are some questionable trials and isolated cases that they did that it demonstrated can reduce the viral load. I think that's kind of falling out of favor now, but we'll see as it goes. It's also super expensive, which may be another reason why it's falling out of favor. But that's all I got to say on that. Next medication, and these are some new ones that I found, APN-01. It's a trial that they're actually planning on starting soon in China. So what it does, it targets the ACE2 protein. We kind of briefly mentioned it. So ACE2 proteins protect the lungs from injury due to respiratory distress and other SARS illnesses before showed that they use this protein to infect cells in humans, which is why there's some potential for this medication. Favipiravir is another one. It was approved in China for symptom management. It's initially used for inflammation. So I don't know how we will be using that here, but that's one of those that was just something that I thought was reasonable to bring up. Finally, steroids. This is a big one. So there's questionable benefit. We do say not to use. We've done like modules and all of that as residents as well. And we do say we don't use steroids unless a patient has ARDS or there's an indication for other reasons. So steroids were used in those with severe illness in China. And there was some concern about a prolonging viral replication leading to need for being ventilated and having high mortality rates. So they are to be avoided unless indicated for other things like mentioned ARDS, COPD exacerbation, or septic shock. All right, moving right along, let's talk about reinfection. There's also been a lot of concern about that, but there's no data about the possibility of reinfection. There have been isolated cases that people note that they're reinfected and they're actually becoming more sick. However, we don't have a lot of information about this, so for the time being, we're considered the chances of reinfection of being low. So viral RNA shedding declines with resolution of symptoms, and it may actually continue for days to weeks. The detection of RNA during this convalescence period does not necessarily indicate the presence of viable infectious virus, which is that's what's the important part. And then clinical recovery has been correlated with the detection of IgM and IgG antibodies, which signal the development of immunity. I wanted to talk about this because this is a little bit important, as I got a text actually from the New York City public health officials or whatever, and they mentioned, oh, if you are IgG, have the IgG antibodies, which means that you've already surpassed the illness, to come and donate your plasma as a way to help other people recover, prevent them from getting sick, etc. This also brings it to the topic of herd immunity. I know we talk about this whole craziness with the vaccines and people not vaccinating their children and whatever people's personal prerogatives are. But herd immunity, the concept behind it is that I don't want to be quoted on this, but I think it's 80%. So if 80% of people have had the infection, then you develop herd immunity, which means that you won't get infected because everyone else around you has developed an immune system and immunity against it. So I think that's the logic behind that. And eventually, hopefully, this will be the case here, but we can only imagine how many people need to be infected before herd immunity is developed, like I said. All right. Moving along to the next thing. So this is more so the most important thing, because if you never get sick, then we never have to do trial and error runs of what will work and won't work on you. So prevention is super important with any disease, and this one is no exception to that. So we don't have a vaccine to date. I know we're working on one, but we could just wait 16, 18 months till the vaccine comes out, or we could start using other preventative measures from getting infected in the first place, given that we see people suffering from this and what's going on. So number one is obvious. I don't think anyone has to be a genius to know this. Avoid being exposed. Don't put yourself in situations where you could get sick with this. Number two is wash your hands for at least 20 seconds. There's different routines for doing it. I could show you how to do it. There's a bunch of them online. It's really important to wash your hands properly, okay? What is this? This is the next number. The next number is hand sanitizer. That's an alternative. So you want to use 60% of alcohol at least. So we have those friends who love really cute smelling hand sanitizers and all of that. This is the time to tell them if it doesn't have at least 60% alcohol in it, don't buy it. I think right now everyone is running low on hand sanitizer supply, so you're definitely going to be getting the ones that work well. Next thing is avoid close contact with people who are sick. Remember that some people without symptoms may be able to spread the virus. Keeping distance from others is especially important for people who are at higher risk of getting very sick, like that list of people we discussed earlier. And then you want to cover your mouth and nose with a cloth face, cover when around others, and that's the best way to really protect yourself. And obviously the 6 feet apart from one another is a no-brainer. At this point, it's everywhere. Other thing is stay home as much as possible, put distance between yourself and other people, and always cover your face when out in public. I think that I drilled that enough. Next thing is more so for physicians or people in healthcare settings in general, any healthcare workers, infection prevention and control in healthcare settings. So I wanted to talk about this. So you want to implement source control for everyone entering any healthcare facility, whether it be a hospital, a nursing home facility, etc. So every healthcare personnel needs to be wearing a face mask. I think right now, at least in our hospital, we don't have a shortage of that, so there's no reason why you shouldn't be wearing one. Visitors and patients, cloth face covering may be appropriate. In our hospital in particular, we're not really having visitors that much, so this shouldn't be much of an issue. Of course, active screening for fever and symptoms before entering. I want to say we don't do a great job at that, I don't think. In general, this is not my institution alone. This is all institutions across the United States and the world. I think it depends where you're taking it, who's doing it, how much we're rushing about it. So it's kind of person to person dependent. But we have seen cases of people being reported not to have a fever, and then they walk into the hospital and they have a fever of 102. So obviously that's an issue that we need to work on, but at least we know that's something that we need to work on. So next step would be taking action in regards to this. But anyways, key concepts are to reduce facility risk, isolate symptomatic patients ASAP, and obviously protect healthcare personnel, because if we don't protect ourselves, we can't help other people. Okay. Moving along is PPE for healthcare personnel. So this I saw in the CDC. I thought this was very important. So obviously at the very least you want face shield or goggles. I know it's very, very hard to get goggles. Even in our institution, we don't really have access to them. Just buy your own. I mean, that's the only thing you could do now. We can't play the blame game or blaming other people for why we don't have something. I know there's lack of access to some of these things, but I managed to get myself a pair of goggles, so you should be able to do the same. Next thing is the N95 or higher respirators. If the respirator is not available, you could do the alternative PPE, which would be the face mask. The issue is obviously higher respirators would be great. I would love that. They're expensive. If people want to donate them, great. But otherwise, I think N95 will suffice for the time being. And face masks as well. If you feel like you need to double up and that helps you, go ahead and do that. Obviously, one pair of clean, non-sterile gloves and an isolation gown. I know some places are running low on isolation gowns. Don't know how that's going to be moving forward, but that's not my level of expertise, so I won't comment on that further. Just hope I have enough so that I could do my job. Note that surgical face masks, I thought this was interesting, are cleared by the US FDA for use as medical devices. Face masks should be used once and then thrown away in the trash. They are reporting that in the CDC, but we are reusing our face masks a lot. I'm actually recycling them every 4 days because that's when the virus is supposed to get off the face, the cloth masks. But not too sure how that's all gonna work. But anyways. Moving along is the user seal check. I did not know about this, and maybe I'm not bright enough to know about this. None of us are doing this, though. I want to throw that out there, not just me. So please look this up. This is something you should be doing every time you wear a mask. So I know that we had a PPE lecture. Hopefully that taught you guys something. But if it didn't, there are good videos on YouTube. Maybe I'll make one of my own. Anyways, we get fit tested to wear an N95, which is why we get so, how do I say this the right way? Upset or concerned when I go to Trader Joe's and I see the general public wearing an N95 mask. They're not even crisscrossing it, and they weren't fit tested for it. So you don't know if what you're wearing is actually fit to your face. So that's when I think I personally get upset, because this is a waste of mask that could be using to people who actually did the fit test challenge to wear it. I think I posted a video somewhere of me getting fit tested. So I know we do that annually, but you also want to do a user seal check. So the seal check is every time you wear a mask, because obviously masks can be deformed as well and not working well. So you want to try this. So basically how it works, you cover the mask lightly with both hands. If you do the positive pressure checking, you're exhaling gently, and then you should feel that there's no air coming out or leaking out of the side of the mask. And then for negative pressure checking, you do the same thing. Cover the mask lightly with both hands, and then you inhale sharply, and the mask should actually just press slightly inward. So if that's working, then that means your mask is working fine. So that's very important. Next one, I want to talk about my personal work routine and home routine, things like that. It might help some people. Obviously, there's definitely more extensive things that you can be doing, but just like a quick summary, every time you get to work or wherever you're at, sanitize your workstation, wash hands, sanitize after every encounter, period. You know that it may be possible that by touching a surface or object that has the virus on it and then touching your own mouth, nose, or possibly your eyes is a way of viral transmission. We talked about that. You want to avoid touching your face, hands, or mouth. I know it's very hard when people tell you to not do things, to actually not do them, but this is the time that you should listen to what people are saying. You want to wear a mask and goggles or a face shield. So if seeing COVID positives, you can actually wear the same mask, but from room to room if they're all COVIDs. But if you're going from a COVID to a non-COVID room, you want to make sure you change your mask. This obviously depends of if you have like a COVID unit, if you're actually seeing COVID patients or not. So those things are to consider. Even though we might be seeing COVID patients and not knowing, this is just the general consensus. Prepackaged foods is another option. Social distancing, having a change of clothes. So I bring 2 pairs of scrubs, one that I go and work with, and then I change into a pair of scrubs before coming home and changing yet again. Do not share supplies. This is the time that sharing is actually not caring. So don't share your stethoscopes, your pens, etc., all other things. Use common sense, even though we all know that's not that common, even amongst us. So just try to be a little bit more mindful these days about what you do and don't do. Moving along, personal home routine. So as soon as I leave work, do my little scrub change, I sit down in the car, I sanitize upon getting into my car, sanitize upon getting into my house, take off my shoes and my scrubs, do a thorough hand washing, then clean any of my tech devices, so my cell phone, my computer, anything that I may have used at work. Then I obviously clean your house and frequently touch surfaces often. You should really be doing that all the time, but if for some reason you weren't, just a good time to start. But I would recommend cleaning doorknobs, car doors, etc. Frequently touch your mezuzahs, whatever you touch. If you don't live by yourself, you want to avoid contact with other people. Don't be the reason other people are sick. And I can't reiterate that more. I gave you an example earlier, and that's kind of why that's important. All right, moving on is coping and support. So let's talk about some wellness at the end of this. So obviously, there's a lot of stuff going on about the detrimental effects, not only on your physical health, but your mental health. Also, there's concern for development of anxiety during and after this, as well as new phobias such as agoraphobia, which is the fear of the marketplace, or generalized anxiety disorders. Depression also is another thing due to like being away from people or the social isolation, but also from, God forbid, getting someone sick and being responsible for their illness and or for people dying, etc., and even being depressed from getting the illness yourself. So that's also a very important point. So things you can do, obviously stress management, eat healthy meals, sleep hygiene, physical activity. I know that those who are in quarantine aren't as active, so it's very important to still do like your yoga videos, exercise on your bike. They used to recommend to go outside for a walk, although now that's less recommended given the whole asymptomatic situation. But you could find means to go about this, whether or not you are poor, rich, etc. I don't think that makes a difference. I think physical activity is more so of a mindset. I know we sit a lot of the time working on our computers for those of the people who are working from home, but there's ways to sit appropriately, getting up every like half an hour or so, doing a little exercise. So there are ways around that, of course. Other things are relaxation techniques. You want to do deep breathing exercises, stretching, meditation. You want to avoid excessive use of social media. You're a doctor. I mean, if you're not, you're a human being who has common sense, but if you're a doctor, come on, please don't be feeding into the mass hysteria that's going on. I know we hear a lot of stuff in social media and all that, and we know that a lot of that is not true. So you want to kind of, for your own mental health, avoid listening to things that are obviously not necessarily factual. Connect with family members and friends. I don't know about you guys. I speak to my family all the time and to my friends all the time. If you don't usually do that, this is a good time to start. So yeah, moving on, pick up new hobbies or old ones you previously had no time for. This includes reading a book, movies, watching shows, watch Sopranos for the 20th time, any business plans that you want to create. I don't know, whatever your prerogative is, this is the time to do that. And of course, avoid excess alcohol and caffeine. I mean, they say that all the time, so not as it's mentioned here. Next thing, if you're sick, how should you cope? So a little bit kind of the same off the last slide. Rest, stay hydrated, keep people in the loop about symptom severity, avoid close contact with family members or friends, aka literally quarantine yourself. Try to be as active as possible, and if this is starting to also impact your mental health, call your doctor. There's a lot of telebusiness going on right now, so it's easier than ever to talk to someone if you need to, whether it's about your general health, your mental health, etc. So I think this is a great outlet for people to use now. Next thing, I wanted to give a few slides about mental health resources that I found. So there's the National Disaster Distress Helpline is available to anyone experiencing emotional distress related to COVID-19. There's also the National Suicide Prevention Lifeline. You could get coping tools and resources there. There's also the Vibrant Emotional Health Safe Space, and then there's the National Domestic Violence Hotline for those who want to have continued support if you're a survivor and want to have some continued support for those who have worry of something new going on. Other resources, CDC has a Manage Anxiety and Stress page. Then there's the National Child Traumatic Stress Network that has a guide for parents and caregivers to help cope with the coronavirus. Then there's the Mental Health America range of resources. There's a bunch of them. Thrive NYC has their own for New Yorkers that they can access while staying home. I'm pretty sure we could all access those. SAM, HSA has their own coping with stress during infectious disease outbreaks, taking care of your behavioral health, and then talking with children. These are tips for teachers, caregivers, parents during infectious disease outbreaks. Another slide about this is Vibrant Emotional Health Safe Space. If you feel or someone, again, needs emotional support, again, the Suicide Prevention Lifeline is another one. Managing anxiety in an anxiety-provoking situation. If you're worried that someone in your life may be suicidal, there's 5 steps to help someone. And then Action Alliance had their own COVID-19 messaging guidance with resources. So there's a bunch of places. We live in a time where we have Google. I don't know if you guys just found out about it, but there's a bunch of places to find resources and help if you need it. Obviously, family, friends are there for you as well. There's always a source, so please try to reach out to those because there are always people who care about what you're going through. Also, for people who are suffering a little less, you can use Headspace. It's a great app for meditating. I use it. And then if you want a financial talk at some point, I got you on that too. Anyways, let's move along to myths. I thought this was kind of a funny slide and kind of sad that we believe in things like this. So 5G mobile networks do not spread COVID-19. Exposing yourself to the sun or temperatures higher than 25 degrees Celsius does not prevent the infection. Catching COVID-19 does not mean you will have it for life. And being able to hold your breath for at least 10 seconds without coughing or feeling discomfort does not mean you are free from the coronavirus disease or any other lung disease. If you want the full list of these ridiculous myths, World Health Organization has them. It's pretty insane that we live in such a society. Anyways, moving on for my final slide. So future pandemics, this is reflection, lessons learned. You want to take action early. You don't want to wait for other people to take action. I really hate looking at other institutions and situations, seeing what they're doing, and if it's not working, why would I adopt the same model? You want to be ahead the curve, not doing the same thing other people are doing, because what you might do might actually influence other people around you to do the right thing. Oversupply is always better than lack of supplies. I know that puts a little bit of a financial burden, but I think we're already in one regardless, so why not protect people in the process? Over preparation is always better than under preparation. And then you want to set an example, which is kind of what I've already alluded to. Obviously, don't panic, limit media hysteria. We see all this stuff going on in the news. We like to point fingers, the government did this, our leadership did that. Those are things that I think right now is not the time for. Yeah, we could all be genuinely upset, but I think taking that, incorporating it, and doing something different or better is the best way to help everyone, all parties involved. I could go and blame whoever I want for this situation, but it won't change the fact that we're in it. So I think that's something that's a big take home that people should probably do. Anyways, protect yourself first before protecting anyone else. This is very important, even for physicians, nurses, everyone in the healthcare field. If, let's say, you're going to a code, you need to put on your gear properly. Rushing to go into that code, not putting in your gear properly on, and then risking not only exposure to yourself, I know we're trying to save lives, but risking exposure to yourself and to other people that you may treat thereafter, it will be a lot more tumultuous of a situation. So please protect yourself first before protecting those around you. I think this is 101. We've all taken planes before, and the same thing is on the plane. They tell you, put the stuff on your face first and then put it on the person next to you, including if that person's your kid. You can't protect other people if you can't protect yourself. Next thing is start treatments proactively. It's unclear what works and what doesn't work, aka you won't know until you try the meds treatments. There's room for trial and error here, even from a legal standpoint, because if we don't do anything, it might be worse. And if we do something, yeah, there might be risks and side effects involved, but if we see something that's promising and makes sense to do per your clinical expertise, you should go ahead and do that. At least that's my personal opinion. I'm not trying to force anyone into anything they're not comfortable doing. But yes, take this experience as a lesson on things we should have done better so it never happens again. Of course, don't be a hero. This is not the time to be a hero. This is the time to use logic and common sense and protect people as a whole and not just an individual aspect. Oh, and of course, love one another. This time has kind of showed a lot of sides to people. There's a lot of people that are showing a lot of love but not really meaning it. There's a lot of people that aren't showing love at all. We've all seen people side-eye us or do weird things when we're out in public, and this just kind of showed that we really do need to stick a little more together. There's, of course, a group of people who do love and want to promote happiness genuinely, not just for that's the thing that we got to be doing now. But I think this kind of puts a lot of importance on our general individual values as a human being in society, and this has really been an eye-opening experience to see how this all unraveled on us and things that I will think about definitely moving forward, and I hope other people do too. This is a cute picture that I found, love for everyone, even though in reality it doesn't seem like that's the case, but I'm hoping we could continue to promote that and eventually get to that point. These are some of the references I used. Really, it was CDC, World Health Organization, a little bit of Healthline just for some information. And I think that's it. Thank you guys so much, and I hope you guys learned something from this. Thanks. Bye.